Good afternoon, everybody. How's everyone feeling after lunch? Energized, excellent. So I remember a little phrase by Spider-Man who said, with great power comes great responsibility. And I'm going to talk a little bit about how the power of technology, especially digital data and the power to persuade, is changing the medical profession and its responsibility to share what is, in the end, scientific and medical truth to our patients and to the wider community. This is the road which I work on. It's a famous road in London, which even from the time of when the Kellogg's were doing their thing in the States, was beginning to be the place where private doctors used to hang out and charge lots and lots of money for doing things behind closed doors. It's called Harley Street. Lots of people know this as being a place in the past where very expensive people consulted and sometimes did things that were not necessarily the best, but because they were on Harley Street, the brand managed to sell itself. And now today, it's quite an extraordinary place, but still it has a bit of a reputation. And the reputation is that as a brand, it's able to sell things that perhaps you wouldn't normally do if you were just speaking from science. And this is how sometimes I feel. It's a question. You know, if you're moving into a commercial world, if you are treating your business as a business, which medicine is in private practice, you have to balance out the things that you do from science versus the things that you need to do as a business. And it's a constant challenge, and it's a challenge that pervades through this industry, the creative health industry. We're talking about truth, we're talking about science, we're talking about fact, but we're selling stuff. It's an interesting ethical issue that is only becoming more and more of an issue as the power to persuade and the power to reach out to millions and millions of people at the click of a button through a social network or through an auto-modifying, artificially intelligent, enhanced advert, and all of those capabilities become more commonplace.
My story starts in 2012 when I did an audit for our hospital, and we do loads of audits every year. And basically, just in case you don't know, an audit is where we measure what we're doing against a set standard of guidelines or best practice. And we found in our case that only 60% of staff were aware that we had any asthma guidelines at our hospital, which was pretty embarrassing because we were a respiratory hospital. And only 45% of staff actually said they were using the guidelines for asthma. And this was pretty shocking stuff. But things got even worse when we asked them specific questions on how well they could manage asthma. And in some cases, doctors were only able to answer about 25% of questions correctly. So we knew that something needed to change. I rewrote the trust guidelines, and I put them on the intranet. But doing that is what generations of doctors before me had done, and it doesn't work, because otherwise doctors would have been following the guidelines already. And whilst I was driving home that day, I turned on the radio, and I had a bit of a Eureka moment. And for some reason, this one stuck, because many times I think I've had good ideas. I'm sure we all have good ideas about things that could be better at work or in the home. But very rarely do I actually write it down. I forget most of my good ideas. I rarely look into making it work. And then as soon as I hit a barrier, I usually give up. And in the NHS, unfortunately, there are lots of barriers to good ideas. Usually, it's something along the lines of not being an expert in the idea or not knowing if you can make it work yourself, not having enough time or money to see your idea through. And there's a lot of people around you who will be ready to put you off and say that this thing isn't a good thing to pursue, or it could harm your reputation or your organization. But for whatever reason, I really held on to this one. And I think one of the things that really spurred me on, actually, is this quote by Albert Einstein, which is that insanity is doing the same thing again and again and expecting a different result. So our audits were not going to get better unless we tried something drastically different. I recognize that guidelines for asthma are pretty boring. And rather than telling our doctors they must use guidelines or there's a punishment, I decided to flip that thinking round and present the guidelines as a reward themselves, as an entertaining thing, something that you want to engage with. And also, remembering back to my childhood and listening to the song in the car, rhymes are easy to remember, and you remember the words and so on. So I decided to do something quite different. I rewrote the guidelines, I turned them into music, I sang them myself into my mobile phone, and I recorded myself doing it in a field. I put it out on YouTube. And this is basically a little clip of that video.
You'll say, I know all the guidelines, but we've done an audit from the sidelines, and we know you're all just wrong.
I'll forward it through a little bit, just for the...
'Cause if I said, what about grading severity for a 20-year-old who can't speak in full sentences? Her chest is quiet and she's looking exhausted, and salbutamol nebs are the best that you've got.
Might be wearing... Oh, thank you.
I think that we're just drawing to a close now. My final question to you is, do you see a role for next-gen medical education which involves creative communication actually not being a retrofit, but actually being a grassroots medical education piece? What with the fact that it takes us 6 years to even do the basics? We don't teach anything about data, AI, analytics, about the rapid and exponentially advancing technologies in medical school even. If you had to change one thing in medical education, would it be how to communicate? It sounds like you're possibly leaning towards that, but what else would you do if it wasn't that?
This doesn't quite answer your question, but the thing which is most apparent for me, and I can only answer for the NHS, and so this probably isn't the same in America, but what we see and what we know and what the amazing sort of social media and the internet and the Internet of Things and all the stuff that we know about, because we're all humans as doctors, none of it exists in hospital because we're still using old, outdated computers and so on. And I think that is a huge barrier to people being creative, because they're still forced to use old technology. And so actually, even more than medically educating people, I think it's important to try and somehow bring the NHS up to speed technically.
Yeah.
And I think that would really help actually with communication and creativity, because people would find new ways of using social media or whatever in a creative way, but in an ethical way and so on. Yes, of course, medical education should form a part of what we do, even as a student, and maybe not so much like cell microbiology or something, but you do learn a lot on the job. And actually, speaking to patients face to face, you will get it wrong, and you'll obviously offend a lot of people, and you'll ruin a lot of lives, but you'll end up saving so many lives or helping so many lives when you learn how to do it right. I think that is much better than anything we can teach them.
Interesting, yeah. So perhaps looking at our daily practice not just as a matter of prescribing, but an opportunity to think and create, not be bogged down of 5 hours of electronic medical records entry for every 2 hours of patient contact, might give us some more space.
Yeah, absolutely.